Now, let's turn to the raging COVID-19 pandemic in the U.S. The country has already reported over 2.3 million cases and more than 120,000 deaths as of Tuesday. 10 states have reported record numbers of new coronavirus cases last week. Another 9 states are also seeing record high 7-day averages, along with a swell in hospital cases. The surge in new infections comes as states began reopening. Residents are being advised by some states to take social distancing measures more seriously. Dr. Anthony Fauci, the leading figure in the White House coronavirus task force, has warned anti-science bias in the U.S. has become really problematic. For the latest on the COVID-19 pandemic in New Haven, we have Xi Cheng, who is Associate Professor of Health Policy and Economics at Yale School of Public Health. In Providence, Dr. Megan Rani, who is emergency physician and lifespan from Brown University. And in New York, we have Vincent Raccaniello, Higgins Professor at Department of Microbiology and Immunology at Columbia University. Welcome to the three of you. We got great experts coming from 3 well-known universities. I want to have, first of all, your assessment of the latest situation inside the United States.
Yeah, in short, it's a mess because we had 2 months in lockdown to get ready for this, and we didn't do anything. We're not testing enough. We're not wearing enough face masks. We're not keeping physical distance. We're doing everything wrong because there's no direction from above in this country. It's left to the states, and they don't have the resources or the abilities to do that. Some states have done well, others have not. And perhaps most problematic is that many Americans think it's over. They think the virus is gone, and it's still here. So I'm afraid to say that this is going to continue for a long time until we have a vaccine, unfortunately.
Well, Dr. Megan Rani, tell me more about how do you see the recent opening up and then closing down of some of the states inside the U.S.? Which stage are we in now?
So many of us in medicine and public health feel that we still have not gotten out of the first wave of COVID-19 across the United States. We've seen a significant decrease in the number of cases and hospitalizations in the states of the 3 of us tonight: New York, Rhode Island, Massachusetts, Connecticut. We reached our peak, and thanks to shutting down and good public health measures, saw a decrease in the number of cases, hospitalizations, and deaths. But other states, particularly in the south and the west of our country, are having daily records broken in terms of new cases, the percent of tests that are positive, and of course, and this is dominating the news today, the number of hospitalizations, particularly in the state of Texas, that are overwhelming my colleagues down in San Antonio and Houston right now.
How should we understand all of this latest development, Xi Cheng? U.S. is such a huge country. Whatever is happening over there is going to have a huge impact on the world's performance of containing COVID-19, and will also have a huge impact on how this current wave is being dealt with and what is the real content of the next wave if there were another wave. Xi Cheng.
Yeah, indeed, we are all in this together, and I think the main issue for the United States, and which also been affecting the rest of the world, is we're delaying the actions to ramp up the testing and tracing, for example, compared to South Korea, which is a very good example because both countries found the first case on the same day. But the U.S. was only able to catch up with South Korea in terms of testing after 100 days. So during those time, the travel was throughout the world between U.S., Europe, and Asia. But the testing was not giving people information about their risk. And I think what's very worrisome is still at the national level, at the federal level, there's no national strategy in multiple fronts.
We've seen political situation inside your country also getting ever more complicated. Do we know, scientifically speaking, Professor Raccagnano, how much impact this will have on the current, already challenging situation in the U.S.? For example, do we know to what extent the demonstrations and the close contacts among those demonstrators and also onlookers, as well as among the police, will have in terms of new numbers?
Unfortunately, it's hard to know what the impact of the demonstrations, close contact will be. We saw a surge in cases in the U.S. after Memorial Day, when people went outside in big numbers and got close to each other about 2 or 3 weeks ago. So the assumption is after the demonstrations we are going to have increases as well. And I did myself go to a demonstration 2 weeks ago, and everyone there wore a face mask and stayed a good distance apart, but that's not the case at all of them. And as you said, when the police get involved, then there's more contact. I do think that it's necessary to do these things. This is very important in the scheme of the U.S., you know, many people think it contradicts what we've been saying all along, but I think this transcends the infectious disease, and we have to learn how to deal. I think it can be done safely. The problem is that many people don't wear face masks and get too close to one another, but if they did, I think we could control it.
Dr. Rani, to what extent the political rallies will have on the control and containment of COVID-19? We saw the incumbent president having his political campaign not necessarily asking people to wear masks, but only say it's an optional. So from now on, things like that will happen at much closer frequency. What would that mean? Is there some scientific research about that?
So there's been no research to date about the effect of rallies, but I will say from a scientific perspective, going off of Dr. Raccagnano's comments, the things that scare most of us about those indoor rallies are precisely that they are indoors and people are not socially distanced. If you looked at the pictures from Trump's rally on Saturday night, there were not necessarily a lot of people in that stadium, but gosh, they were packed awfully close together. There was no 6-foot spacing in between the attendees at the rally, and there were very few masks worn. So if there were people who were positive for COVID-19, and we've seen from churches and choirs that there's a great spread of virus when people are in those closed spaces and yelling or singing, and we're all concerned that the same thing could be happening at rallies. It is not, from a public health perspective, the world's smartest decision to make, to put people close together without masks or without social distancing in an indoor space.
Starting from Dr. Fauci to many different other experts, including the three of you who are, you know, certainly expressing your concerns and worries. And do people really listen to your words? Do your words still matter currently?
Since 3 of us are all at the East Coast, there is one phenomenon I want to bring up is the coordination between the states in East Coast, especially Northeast Coast, 6 states: Connecticut, New York, New Jersey, Rhode Island, Pennsylvania, and Delaware. And those 6 states announced in April creation of a multi-state council that developed a regional framework for safety and for gradually lifting the stay-at-home orders. And that council was composed of economists, public health researchers. That was a good example that those voices from scientists, from economists can be heard by the governors and to make a decision about the reopening.
Same question I want to ask to the other 2 professors.
It depends where you are in the U.S. I think many people would like to get good advice from public health officials, physicians, and scientists, but there are many others who distrust science. You know, there's a general distrust of science among many people in the U.S., and it goes not just to infectious diseases, but to things like climate change and environmental issues. And experts are not trusted. So instead, people listen to news programs, perhaps, or politicians where they get the wrong message. So I think This is a problem with this outbreak.
Dr. Rani?
So I think there are a couple parts to it. So when you look at public surveys of who people trust, most people say that they do trust Dr. Fauci. I think many of our nation's most preeminent public health experts have unfortunately been largely missing from the discussion. We've heard from Dr. Fauci, not as frequently as some of us would like. We have not heard a lot from Dr. Redfield, who runs the CDC, right? And there are other national public health experts at all who have been largely missing from the discussion. That's really too bad on a federal level because they failed to set the standards which can guide all of the states. That said, when you do look at surveys of Americans, the majority of them do still support physical distancing and mask wearing. The trouble becomes we're all human, right? And if we don't personally know someone who's been affected by COVID-19, it becomes very difficult to maintain these precautions when you go into weeks and months and you look ahead and you don't see a clear end in sight if you're not getting clear messaging from above. And that's where that governmental messaging is so critical from the federal level and then from the state level. And so as Dr. Chen and Dr. Raccaniello have mentioned, that's why we're seeing a big difference between different states. So I would say that the public health perspective and the scientific and expertise of the three of us and of many, many other folks across the country are being listened to in some states, but not necessarily in all. And I think that we have to do a better job of our public health messaging. Unfortunately, we do depend a bit on government, politicians, and on influencers to help spread that message, particularly to populations that have not yet been personally affected by this disease. If you go to New York City, it's a little easier to convince people, but even there, they're tired right now, right? They're tired of staying inside, and that is human nature. And so we have to make it easy for people to do the right thing.
Earlier in China, during the first stage of the outbreak, things were devastating and people are so concerned. Even during the latest spike in Beijing, many people are concerned what the future is going to be like. So I want to genuinely ask the three of you, who you are there in the U.S. I mean, why shouldn't there be more care about human lives? You know, if I see it as a journalist, a story, but really you're functioning inside such a situation. I want to have your personal, approach to what is really going on here, Professor Raccaniello.
It's very hard. Even though life looks normal from the outside, even in New York City there are fewer people around, it looks more or less the same. But if you start talking to people, I've been speaking on a daily basis with a physician who's taking care of patients, an infectious disease physician, and it's a horror show. And so my view of this is that it all could have been prevented from the very start, and it's frustrating for me, on top of all the other problems we have, mainly caused by the current administration, I should say. Now we have this natural disaster, which could have been dealt with in an efficient way like many countries have done. Your country, with far more people than we have, did an incredible job at restricting its spread, and we could have done so as well. So I am personally very frustrated, and I tell everyone I can talk to, you should be furious that in a country like the U.S., with the science and medicine that we have, that we couldn't stop this. It's completely unacceptable, and for it to be shrugged off a few months ago by our president, it's just unbelievable to me.
Dr. Rani, you and I were talking about the PPE, and the PPE over the past few months. Now, I don't want to repeat that conversation, but really your personal account of what is really going on around you, whether are they really reflected in the public discussion and domain? Are policymakers really looking at the situation?
Yeah, I couldn't agree more strongly with Professor Raccaniello that this is just so unbelievably frustrating for all of us to see that we messed up in February and March. Well, now we have a breather. We have a moment where we could stop this from spreading again, and we are simply not taking advantage of the moment. People are exhausted, and this has been presented to Americans as this false choice between preventing spread of the virus and keeping our economy closed. There is a way to reopen, to allow people to have some socialization, to allow the economy to restart, to get our kids back to school. I'm a parent of 2 little kids. This is exhausting, I'll be honest.
Yeah.
But there's a way to do all of that and to do it safely, to minimize spread of the virus, so that we don't face situations like what are happening in Texas right now, like what we faced in Connecticut, New York, Rhode Island, and Massachusetts, New Jersey, a couple of months ago. And I think we're just all unbelievably frustrated and trying to figure out the best ways to influence policy. Again, those of us on this interview are lucky to have state governors who are focused and who are listening to science, so our states may be okay. But I think there is this larger messaging that needs to be taken to protect us. And you know, it's no fun to feel like the killjoy, to be saying, well, no, we all have to stay home, we have to stay distanced. But at the same time, you know, there's an ice cream shop in my state that just posted on Facebook how frustrated they were because their kids who are working at their ice cream shop are getting yelled at and insulted by clients who are showing up and wanting to order ice cream and sit on their deck without masks on. That's not fair to those kids. It goes against my governor's orders. And it's simply infuriating because it puts the rest of the community at risk. So I think we're all tired, we're frustrated, and we're trying our best to create a better situation going forwards, but it's going to take the community coming together. And although I think most Americans are on board, it just takes that, 20% to kind of ruin stuff for the rest of us, unfortunately.
How much evidence and numbers should we gather to figure out whether the United States by itself will become a place of herd immunity if the current situation continues?
So for us to reach herd immunity would require infection of such a large proportion of our population and would likely cause such tremendous numbers of hospitalizations and deaths that, to me, that is not a valid thing to try for. There are a lot of questions for us to answer still, but the current data is that we are nowhere near herd immunity. And the scale of destruction that would be caused by pursuing that strategy would just be more than I think our society could take.
Is there a possibility, Professor Racaniano, that at the end of the day, is herd immunity the way to go? Our policymakers now in Washington secretively thinking that probably is an option. After all, it is not controllable right now, cannot be contained, the COVID-19 in the U.S. Do you suspect that? I don't want to use conspiracy theories, but it seems that the phenomena is only leading all of us to suspect that.
There's no way, as Dr. Rani just said, that we can achieve herd immunity without losing hundreds of thousands of lives. Even if the fatality rate is 1 and 1.5%, if you want to infect 200 million Americans, that's a lot of deaths. Yeah. So that can't happen. Although in many states, the infection is running rampant. I think what we have to do, as we have said before on this show, we have to do a better job at testing, tracing, and isolation. We're not anywhere near what we need to do, and that's the key to reducing the number of infections. If we know, for example, that people less than 60 years of age generally have a mild infection, we can use that information and tell older people who are at risk, perhaps are not working, they need to stay home. And the others who are out and about, they have to wear face masks. Every state has to require face masks, and we're just not doing that. So we don't need to have herd immunity until a vaccine is available. I don't think that's necessary, but we're not protecting ourselves in the meanwhile, and that's the key.
There are so many things that can be done, even at the current stage. Agree, Xi-Cheng?
Yeah, indeed, I agree with the other two guests, and I would say that we are not putting anyone's, especially the general public's lives on this bet with the herd immunity. And even if that's true, that we do not know how long the immunity could last.
I want to wish all of you good health, so are your beloved ones. For now, I want to thank the three of you passionately helping us to understand all the latest development and also be able to openly voice your expert views. Thank you so much. Xi-Cheng, Megan Rani, Vincent Racaniano, thank you so much. All the best.
Thank
you. Thanks for having us.
Pleasure.
And that's all the time we have for today. If you'd like to see more, you can certainly search World Insight in the search engine or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching.